Welcome to FYI TV, the show that helps keep you informed on some of today's most important topics. Hello, I'm Joy Hubbard, and our program guest today is Dr. Demerius Ware of Detroit Injury and Pain Centers. Let's take a look.
Dr. Demerius Ware obtained a Bachelor's of Science from Fisk University in Nashville, Tennessee, and a Doctor of Chiropractic Medicine from Life University, Marietta, Georgia. For many years, Dr. Demerius Ware studied and researched auto accident injuries and the auto insurance industry as it relates to the victim. He has become the foremost authority amongst his peers in managing auto-related injuries.
Welcome back. Our guest today is Dr. Demerius Ware. Dr. Ware, it's a pleasure to have you on the show.
Thank you for having me.
Tell me, how long have you been in practice?
I've been serving the community for about 10 years now.
You're located right in the heart of Detroit.
Yes, I am.
Tell me where you're located.
We're currently located at 7220 Gratiot in Detroit, Michigan.
Dr. Ware, what field do you specialize in?
I specialize in auto injuries. And in the last 10 years, I've noticed a big change in the auto industry as far as there's a lot of accidents that are going on in Detroit in a no-fault state. This is Michigan, it's a no-fault state. And during the research in the last 10 years, I've noticed a big, huge whiplash increase.
Doctor, what is that number of increase?
In the last 10 years, it's increased dramatically. The average whiplash or injury that's sustained in an auto accident is approximately 1 million accidents a year, which comprises about $30 billion in the industry, in healthcare.
Okay, let's do this. Let's take our audience all the way back to the beginning. There is an education involved, a strenuous process, correct? With chiropractic medicine. Let's talk about that.
Well, Joy, there's a misconception about the level of education for medical doctors and chiropractors. We actually go through the same type of education, whether it's anatomy, physiology, whether it's biology or microbiology and organic chemistry. In fact, based on the Grisanti report, which was taken in 1998, and I'm sure now that we've had more classes added to this report, we take approximately 200 more hours than medical school students.
Wow, doctor, so you're actually required to take 200 additional credit hours in your field?
Yes.
That means that you are?
We're board certified, we're state certified. We also have an extensive certification in clinical studies and x-ray radiology. We're also highly trained in physical therapy. I have a full rehabilitation center at my clinic, and also chiropractors go through what is called a postgraduate study as well, so we have to continue our education in order to, one, keep our license current and also stay abreast on upcoming medical knowledge and information.
Good. So Dr. Ware is certainly dispelling that rumor that there's more to chiropractic medicine than meets the eye. Doctor, can you explain the neurological system to us?
Sure. The brain and spinal cord is first developed in the embryo. From there develops the buds of the arms and the legs. Okay, the spinal column is the most important part of the human body. You notice that the brain or important organs are encased in bone, such as the brain is encased in the skull. The spinal cord is encased in the spinal column, which we call vertebrae individually, and also you'll see the rib cage housing the heart and the lungs. Those are the most vital and important parts of the body. Another thing I want to point out is your reproductive system. The reproductive system also is encased in a pelvic girdle. Wow. So that also protects something that's very vital and important to the human body. The neurological system, however, is so important that without the neurological system, you would cease to exist. It sends information up to the brain and sends information down to vital parts of the body, such as organs, the heart, the lung, and it actually communicates just like a freeway. Okay, you see cars moving back and forth. Well, that's what cells do in the human body, in the neurological system. It communicates to tell you or to tell the brain what's going on with your body, whether it's injured, whether it's in pain, whether it's cold, or something is hot, and you have certain receptors in the neurological system that actually tell you that.
So your hip bone is really connected to your thigh bone.
Yeah, it is.
Okay, let's talk about how this all relates to accidental injury. That's what you specialize in your office,
yes.
Right? You talked to me earlier about whiplash and how that can affect the whole system you just broke down. Let's talk about how that relates. When you sustain an injury, and it is whiplash related, something happens. Let's talk to our viewers about that.
Well, whiplash is so serious. Let me explain some of the things that you experience in whiplash. You have a lot of different organs that play a role or that take part in this injury. You have the neurological system. You have the osseous system or bones, and you have the actual muscular system. So we call it the musculoskeletal system. Whenever you're involved in an auto accident or you sustain injury, it doesn't necessarily have to be a whiplash. It can be any type of injury. It can be anything propelled and hit you in your head or hit you somewhere on your body. Whenever you're in an acceleration, deceleration type of incident, you have potential for injury. Okay, your normal range of motion is then compromised, I should say. Okay, you have a hyperflexion, and that's when your neck flexes forward. Okay, because you had a head-on collision, and you have a hyperextension when your neck flexes backwards. Okay, either or, whether you're hit from the rear or from the front, you're going to sustain injury. You have a possibility of breaking bones, tearing ligaments, tearing muscle, tearing tendons. You have also a possibility of slight stroke because, and I'll explain it to you when I show you on the model, the blood vessel, which is the carotid artery, which travels through the bones of your neck, supply blood to your brain. Okay, so you have a potential for a stroke in the event that you're in an auto accident. I've seen it in my office many times before where somebody sustains an injury from a hyperflexion and hyperextension injury, which is a whiplash injury. You will see the symptoms and side effects of the actual accident. It can be anything from dizziness, okay, to lightheadedness, to ringing in ears, to any of the actual cervicogenic symptoms from the accident.
Doctor, you mentioned that when you are in a whiplash injury, there are certain symptoms and side effects that you may experience after the fact. Can you talk about what those are?
Joy, the major symptoms that we all experience, neck pain. We experience a lot of back pain, mid-back pain. We also experience a lot of headaches. I have patients in the office who experience nausea, dizziness, lightheadedness. One symptom that's overlooked is a traumatic brain injury. Now, a traumatic brain injury comes as a result of something that propels in the car, possibly a toolbox or something like that. It may hit you in the back of the head or in the front of the head, or maybe you hit your head on the steering wheel. And that is one misdiagnosed symptom. So I've seen a lot of that in my office, and I know how to recognize the difference between just a regular headache or cervicogenic headache, which is pain in the head and neck area, and a traumatic brain injury.
So, doctor, you recommend highly that someone that maybe has sustained a whiplash injury, they should get immediate attention, correct?
Definitely. Okay. Actually, if you're in an accident, hesitate not to see a doctor within the first 24 hours.
Even if your symptoms don't seem like they persist, you still want to make sure that you get checked out.
Correct. Most people, when they get into an auto accident, they think, okay, well, it's going to go away. I'll just take a few pills and some painkillers, and I'll be okay. We need to understand that pain pills do not correct the problem, and they do not manage your injuries. So once you leave the hospital, where do you go next? I have many patients who come into my office, and I want to say that chiropractic physicians are the foremost medical model for managing auto accident injuries.
So it's more to it than just going into the emergency room and just getting a Band-Aid,
exactly,
which comes in the form of maybe pain medication, right?
Exactly.
All right, well, don't go away, because coming up, we are going to talk about some information Dr. Ware is going to share with us about knowing your rights. Stay with us. We'll be right back.